You're thinking about an induction, but how does that baby come out without Mother Nature just like giving the A-OK? So let's talk about that today. Welcome to The Pregnancy Nurse. I am Hillary. I also run the website Pulling Curls, and I'm the creator of the online prenatal class for couples. We aim to prepare you from bump to bassinet for the confident collaborative delivery that you are looking for. If you are interested in information about inductions, definitely give this video a like so that YouTube knows what to show you and how to give you more information to get prepared for your upcoming delivery. Today we are talking about how they induce you. Now, I've talked earlier about why they might induce you. I'll put a link here in the video, but today I'm going to talk about how and the different ways that they could induce you. Now, there are two different ways of induction. There is a manual way where we do something to you, and then there's a medication way where we give you medicine, which some people could think of as doing something to you, but those are the two different ways that we could induce you. So the first one is manual. Now, there are a few things we can do manually, that means like with our hands, to induce you. The first one is stripping your membranes. Now, this could happen in the doctor's office. Hopefully they ask you before they do it, although I don't always find that that happens. But this is where they take their gloved finger and they circle between the cervix and the bag of waters and just kind of separate those two things. They go all the way around, and then that sweeps up hormones. It kind of gets things going. Now, I find that stripping membranes will bump you into labor if you're not already in labor, but it's not going to push you into labor if you weren't going to go into labor anytime soon anyway. So it is a little bit painful. I've had it done with every single baby. It's painful. It's a longer extended vaginal exam, but other than that, it's not too crazy. So that's what stripping membranes is. Another way that they might induce you is a Foley bulb induction. That's where they take a catheter, they fill up a little bit of a balloon at the end of it, and then they put it in your cervix so that the balloon kind of pushes against the cervix to open it up. This is becoming more and more popular lately because it is something that you can back away from. If we put in that Foley bulb and it doesn't work, we can just stop and say, let's try it again in a few more days, or it can progress you into labor. And so it's a really nice way that doctors use to see if you'll go into labor. Some doctors will even do that and you can just go home with that balloon sitting in your cervix. It's pretty darn low risk. Some doctors want you to come into hospital, and some actually give you medication at the same time that they do that Foley bulb. So there's lots of different ways that you can do it. Now, the third thing that we might do to you is to break your water. Some doctors just bring in patients. Their cervix is already very favorable, which we'll talk about as we get towards the end of this video. But if they break your water, a lot of times your body just thinks, let's go, let's have this baby. And so it starts to contract. So that might be an option as well. Doctors are the only ones that can break water. Do not break your water at home. Of course, this is all entertainment advice only, and I would definitely talk with your doctor if that is an option for you. It would only be an option if your cervix is already very favorable and the baby's head has come down so that it's very low risk. Okay, the second way that they might induce you is medication. There are 3 different cervical ripening agents. They are misoprostol, Cervidil, and Prostin gel. And which one of those they give you, they're all hormone based. It really depends on your provider and the hospital. I know that our hospital really prefers misoprostol because it doesn't have to be refrigerated, which means it's on the unit all the time, and it's pretty darn cheap. Now, some people might hear things about misoprostol. I have a whole post on The Pregnancy Nurse about why it's kind of controversial, but those are the 3 things that they use. They all work very, very similarly, I think, and it's just kind of up to your provider which one they want to use. In fact, some of them are put in vaginally, and some of them you can take orally or stick under your tongue. There's lots of different options. So those are used to just soften your cervix. So let's say you're 1 centimeter and they want to give you a couple doses of that to kind of get you going. And it's meant to like soften your cervix so that when it's ready, we can hit it with the next medication, which is called Pitocin. Now, back to those cervical ripening agents, most often they don't put you into labor, like full-blown labor all by themselves. Sometimes they do, which I totally love it when they do, but usually they're needing to be followed by Pitocin. Now, Pitocin is given in an IV form. You have to have an IV, obviously, to have Pitocin, and it is the most often used agent for an induction. The nurse is going to monitor it very closely. Every hospital has very strict policies about how frequently it can be increased, how much it can be increased, and how the nurse has to monitor it and chart. It just increases your risk because it's a more risky medication. Yeah. So Pitocin is the other way that they might induce you. Now, all of these ways of inducing you kind of are at increased risk. And that's why it's really important to talk with your provider about why you might need an induction or why maybe you could wait, and check out the pros and cons of all that. Now, one of the pros may just be that you are completely miserable, and that is a valid thing as well. But your doctor is going to use something called the Bishop score, where they check dilation, which means how open your cervix is, station, which means how far up or down in the pelvis your baby is, effacement, which means how thick or thin the cervix is, and then also how forward or backward your cervix is in your birth canal. It's a little bit confusing, but the longer you've been a nurse, the more you really notice all these different things. So a good Bishop score means that your cervix is very favorable, meaning it will likely open very easily when we start putting contractions on it. A cervix that is like closed, thick, high, the baby's high, it's very far back. Some doctors will call that a posterior cervix. If all those things are happening, it's going to need more induction agents to get you going. Now, of course, that's really important. If you have high PIH and we really need to get that baby out, we would need to start something that will soften it and get you going. That's why we would start with those cervical ripening agents and then move to Pitocin. But if you're 4 centimeters, you might just need a little whiff of Pitocin to get you going, and then baby may come out all the way on their own. Some recent studies have shown that you can turn Pitocin off once a patient gets in active labor, which would probably be around 6 centimeters, and just see if the body will keep going on its own. That way it's more natural and you don't have all of those chemicals in your body making you contract. Your body can create their own. So those are the way that you might get induced. I hope you liked this video. If you did, definitely give me a big like and a thumbs up down there. And while you're there, go ahead and hit the subscribe button. I'm so glad that you're here learning with me about your upcoming birth. And in fact, I think you're gonna like some of these next videos as well.